there initially because otherwise we can't. Well, I guess some of you can't see either way. You guys, why don't you guys all come? Let's move this table back, please, so that they can get in front. Grab chairs and sit down in front of these people.
Go this way and get out of the way.
This one's wrong, and then Dave and Tanner to be able to see guys.
Yes, I heard him say so.
Okay.
I hope so.
There's not too much to see. There's only one hole.
Yeah.
The name's pretty easy. Probably there's only one hole. Hopefully there's only one spot. Okay, so same thing. I provided perineal care. I've identified the patient. I've washed my hands. I've explained the procedure. Forgetting one of them.
Check the record. Bring your kid.
Thanks.
Provide privacy, introduce myself, wash my hands, identify the patient, explain the procedure. That's the 5. I can't really try to forget. I've checked the integrity of the package, the color, the expiration date. I provided perineal care for the patient. Okay, and so now I clean this down for 2 minutes with my purple wipe. I'm gonna wait for it to dry. You guys okay with that? So now we're at that spot. You guys need to verbalize that just like I do. I don't verbalize it for my health. I verbalize it so you guys get used to hearing it. It's almost the same exact process as setting up.
Huh.
Again, you see that I'm not touching my 1-inch border. Me and Monica had a very long conversation. I wouldn't say it's wrong to touch a 1-inch border when you're a professional. I just think increases the likelihood of error. I can't turn around because if my eyes leave my sterile fluid, I break time. Such a smart ass. Now I just got recorded, Jesus. Show that one to the dean. Or do, she'll think it's funny.
So you're touching the part that's going to go on the table.
You got it.
Do you actually have to provide perineal care? Can you just say it? Like
You
to
know,
test out.
just say it. Yeah, because we have to
He
get
was
through.
like,
I was like, in real life, I was like, absolutely.
Just say it.
Yeah, also, like, I wash my hands. I don't. Ah! Am I okay?
It's okay.
I'm okay, actually.
Keep going.
No, I'm actually am okay, because what did I touch?
it's just the inside touching the sterile.
It's sterile,
part.
sterile, so.
Yeah, right, it's not the gloves. It's not where I touch the 1-inch border. If I touch the 1-inch border, guess what? I'm done. Die? Guess I gotta start over again. Game over.
Oh, I like that color.
You like the green?
Yeah.
Tanner's a fan. 7 hours and 50 minutes, she's retained one thing. There are green sterile gloves and I want them. Guys, you see like a lot of nurses here would open up onto their sterile field. I don't get it. It's not that hard to do. Like just slow down and use your brain. And trust your brain. Don't trust the other nurses that you watch. Tim got to teach. Why did I get into teaching? I love bedside nursing. Love it to death. Why did I start teaching? I was so annoyed with my colleagues. I couldn't stand the way they gave care anymore. And they wouldn't listen to me. Every time it became a bravado match. Who knew more? It's not. I don't know more. I just know what the answer is. So this is the correct answer. What you're doing is not correct. Well, my instructor showed me. Your instructor was wrong. My instructor was wrong a bunch too. You know what I did? I looked in the book. And then I read articles. So then I said, I'm going to start teaching so you guys only know how to do stuff the right way.
You showed them.
Well, my 1,500 graduates or more have not showing them yet. Because I'm dominating. I'm taking over Cleveland with my nursing
Give them a
students.
copy of your book for Christmas.
That's true, I could do that.
You have a book?
I have a textbook I wrote, yeah. Now that you guys aren't allowed to use it, because then it's unethical, which I kind of agree with. Forcing you to buy a book that I wrote. Like, you're already paying me to teach you. They do that.
Yeah.
The dean said, she didn't say I couldn't, she said, you gotta be really careful. And I said, I actually agree with your thought process here. So there's no balloon here, so there's no testing of the balloon.
So
On a
is it just
male,
straight?
yeah, it's a straight catheter. On a male, we lubricate 7 to 9 inches. Did I tell you guys the Dr. Fisher story yet?
Yes. Twice.
3.
I'm turning into my grandfather. It's awesome. I love that man. I love it. He would tell me so many stories over and over again. Same with my grandma.
Did you say you could do a straight catheter on female?
Sure. A straight catheter is just because you want to get a post-void residual, you want to get a urine sample. The patient can't urinate, and you don't want to leave the indwelling in.
So it's more of an in-out kind of thing.
It's 100% in out. My garbage can is not the right spot because I had to move.
Want me
So
to move it?
if
No, it's okay.
patients straight cath at home, do you still do this or do you have
At
it
the hospital, we still do sterile technique because we have organisms that they don't have at home. Yes. Now you can get an order for the patient to straight cath in the hospital, in which case they're going to do the way they've always done it. Good question. All right, once again, I have my 2 drapes. I have my fenestrated drape, which in this case I'm going to do shiny against shiny. So I'm going to do a little bit different. There's 100 different ways to put the drapes on the patient. I'm going to say any of them are right or wrong, just all preferences. And then I have the same as stacked square drape I had before. This one's easy to identify the shiny versus the non-shiny side. Right, the blue is the shiny. Okay. So I'm going to come here, and I'm going to come underneath the penis like that. Is okay with that? Then I'm going to take my fenestrated drape. Again, I like to get it a place where I can't accidentally contaminate my hands.
Are the balls, or the, sorry, I didn't mean, the testicles, are they sitting on underneath, on
They
top
are
of
between
that?
the legs.
They're on top,
They're not on top of the sheet.
they're not on top of the sheet.
No, they are exactly where they are now. That's how I like to do it. A bunch of different ways you can do it, however you want. This poor guy. He's taking pictures of it. Okay.
So can I send her a photo? Why the two drapes for?
Because when people try to take the fenestrated drape and they try to slide it over the penis,
Yeah.
so that the circle or the diamond goes around the penis, I feel like they contaminate the drape when they do that a lot of times. So I've kind of made my own modified technique. Like in my textbook, this is what I discuss.
But why is there 2 for the male? So you use the.
Because you can't, on a female, you can't really, there's nothing to cover on top. And on the female, you're going underneath the legs. So you're underneath the butt. On the male, you have the legs together and you're going on top of the thighs.
Yeah.
It's just preference. Again, I said you could drape it 100 different ways.
I just feel like it offers more privacy for the guy.
Oh,
Do you know what I mean?
we're not worried about privacy at this point. I mean, his penis is sticking out.
How was the thing?
It doesn't matter if it's like 3 inches of the penis or 4 inches of the penis sticking out. It's sticking out.
Maybe he wants his belly button covered.
Okay, so now once again, I'm going to contaminate the patient on purpose. And something that's a small detail is there's a slit in my container here, and the slit is facing the patient. Okay, that's important. There's a little notch cut out. Okay, so there's a little notch in the container. It's cut out. I'm going to take my left hand and I'm going to contaminate my left hand again. Guys, I know it is not comfortable. I never thought in my life that I would grab another person's penis. I didn't wake up when I was 17 like I'm going to do that. But when I became a nursing student, I realized that's what I was going to do. And there's 2 ways to grab it. There's the way to grab it like this, where you gingerly grab it, and there's the way to grab it where you grab it. Grab it. I'm saying that because otherwise the catheter is going to coil inside the urethra on the backside of the penis. So just grab it. You're touching it either way. Just touch it. Okay? Into the urinary meatus ever so slightly. You're going to go around the glands in a circular motion. Same thing again, ever so slightly. You're going to, and again, the urinary meatus on a man is not that big either. And then a circular motion on the glands, going away from the urinary meatus. I'm going to get a sample at the same time here. So what I'm going to do is I'm going to pick up my catheter. Inside my container is my cup. I'm going to put the catheter inside the cup. I'm then going to insert on a male 7 to 9 inches until I get urine. Once I get urine, I go another inch. It's the same exact thing, so for 7 to 9 inches on a male. Once I get urine, I go another inch. I stop. I contaminate the catheter because it's not going any further, and I wait for my cup to fill up. Once my cup is filled up, I take it out. Again, I'm going to end up whipping down the table at the very end. And you see where the catheter is now lying for me. It's in that notch. of my container. And it happened without me even trying. It just keeps it in the right spot. Students always want to ask me, what happens if the container fills up? Okay, so wait a second, I'll show you what, you will be able to figure out that answer in a second. When the urine stops pouring, I tell Mr. or Mrs. Smith, even when I go to DC the female catheter next week for you guys, 2 deep breaths. On the second exhale, I'm going to pull it out. It gives them something to focus on, it gives them a purpose, and it distracts them. Also, exhaling relaxes the extruder muscles, relaxes the sphincter. Everything comes out easier. So 2 deep breaths. Catheter comes out. As the catheter comes out, I grab it. I grab this. I'll be back in a minute to help you getting cleaned up. This can all go right in the garbage. No problem. This comes up to eye level. I measure, I take it in the bathroom. Tell your peers how much volume that can hold.
100 and 1100.
So 1,200 mLs is what it can hold, because you got the room above the 1,100. 1,200. How much do we usually urinate?
300.
300. Never seen a fill up. Okay? If it does, pull out the catheter, do the procedure again, I guess. I don't know. I've never had it fill up before. Okay? This goes in the bathroom, it goes into the toilet. Okay? It does not get into the sink. There's a little shower head that we talked about before. Make sure you don't spray yourself. What are you two doing over there? Pay attention. Okay. Joelle?
You can use that catheter on
Yes,
the
guys.
nipple?
Either catheter can be there's a post-void residual. They're having urinary retention. I'm sorry, they're having residual. So I want to see how much urine's left in it. We want a urine sample. The male has prostate issues, and we want to catheterize once before surgery. Right? The female over there has a UTI. We don't want to put a catheter in, but we want a sterile sample. So we put a straight catheter and take it out. It can be used for either gender.
So straight just comes right
Go
back
straight in, straight out.
Okay.
Fully stays in. It doesn't make a difference if it's male or
I
female.
wasn't sure if straight was just for males or.
No, it's not.
So for the female one, how long does that stay in for?
Ideally, no longer than 3 days. We advocate to have it removed after 3 days. I've seen them stay in for months.
Wow.
Okay, this is my sterile sample. I want to make sure that I don't touch the inside of my cap because I've contaminated both my hands by this point. Get my cap on. Date, time, and initial. Send down to the lab. Has to go to the lab within 30 minutes or has to get refrigerated. Right? I feel like that's right. Within 30 minutes or it has to get refrigerated and they come pick it up. Okay, in 30 minutes and has to have date, time, and initial. Okay, what other questions?
If it was uncircumcised,
Great question. If it's uncircumcised, you have to read. It's called prepuce or foreskin. You do on your perineal care. When I get over there to grab the penis, I'm going to pull back the prepuce with my hand. And then I'm going to clean the glands with the prepuce retracted. When I'm all done, I got to return the prepuce or the foreskin back on top of the glands. It's more important to do so with a fully catheter than a straight catheter. It should always get returned, so don't ever forget to do that. It's pretty easy. There was a patient, Muslim patient at the Cleveland Clinic getting surgery. A resident, a new doctor, put a fully catheter in the male. Retract the prepuce. They pumped them full of fluid during surgery like they normally do. People get edematous after surgery because we'd rather have you have too much volume than not enough. Because we can fix hypertension, hypotension you die, right? So we rather have too much fluid. He got penile and scrotal edema, and no one ever checked to see where his prepuce was, his foreskin. It acted as a tourniquet. It started causing necrosis of the glands of the penis. They circumcised him against his will, right? Because he was in a comatose-like state. Because clearly he didn't want to be circumcised. He was a grown man. He was Muslim. Right, so we always got to return it back to the normal spot. Good question, Ashley. They're going to ask for pictures. I was looking at pictures.
When you take it out, was that a clean technique?
Yes.
Or is it clean technique?
Well, it's sterile because it's inside the bladder. What's coming out is sterile. But yes, I've contaminated both my clothes by that point.
Are we for the test? Are we taking it out, or we just get to the point where we put the cap back on it and in the procedure?
Nope, you do exactly everything I just did.
So you will take it out for
Yep.
the
Straight catheter goes in, comes right back out.
Okay, for either gender.
Nope, for the fully it stays in.
Well, for
Okay.
either gender.
Yes,
the
for either.
straight catheter.
Yes, for the straight catheter goes in, comes back out. If it's a
Okay.
Foley, which is a retention catheter, you're going to put it in and leave it in. If it's a straight catheter, it goes in, comes back out.
So you can get a straight cap for female or male.
Yep.
Or you could get a Foley for female.
Or male.
Or
Either
male.
catheter can be used for either gender.
The difference is the straight catheter is when you are trying to just get like a sample of the urine.
Yes.
Mhm. But the equipment is the same. The technique is the same.
Everything's the same except there's no balloon port on the straight catheter. There's no syringe, and there's no balloon port. But everything else is
Just take it
exactly the
right
same.
back out.
Yep.
Okay, so you have 4 potential combinations for this.
Correct. Your test out does not have 4 possible combinations. It tells you specifically which catheter is going in which patient. It
Right, and
tell-
I'm saying, but we could get 4 potential
in real life.
scenarios.
In real life, yes.
No, for the test.
No, on the test it tells you you're putting a fully catheter in a female, you're putting a straight catheter.
Okay.
in a male.
Okay, all
I
right.
made it easier for you.
And just one more thing, if he has an erection during the procedure,
Great question.
you give him some time, get himself together, or
Well,
yeah, I'll come back in a little bit.
that's a good question. So,
Or I don't know if it hurts. I don't know.
so great question. So if it happens, because it happened once to me, but I knew what to do because someone had asked the question during my class when I was in real estate. And Tom was exactly right what he said. If it's me and they get an erection, I'm gonna say, your penis is getting enlarged, which is normal. You're getting an erection. It makes it easier for me putting the catheter and are okay with me continuing.
Okay.
If they say yes, continue. If they say no, then you give them time.
Okay.
Right? It actually makes it easier because it makes the penis straight. It makes the catheter real easy to go.
Oh.
Makes it easier.
And
And guys, you touch a penis, what happens?
Yeah.
Okay, erection.
But all
So-
penises aren't straight either.
What's that? They're not all straight.
Oh yeah, some are curved, you know.
Do you mean like straight, like? Yeah. Thanks, I got you. Some of them have a bend, is what you're saying. You are on some other planet there. My reality and your reality are not the same.
So I know you made this look pretty easy, but there's patients with enlarged prostates, and at what point do you know that you've passed the urethral part of the prostate there?
So if they have a history of BPH, they get a Coude catheter. The special catheter has a bent tip on it, and it's
Okay.
harder. And you'll notice because you'll go in and you'll hit resistance, and then it's got a corkscrew tip on it. So then you twist the catheter and it screws around the prostate.
Okay.
Oh Lord.
But how do you know you've advanced it far enough that you're not going to balloon within the prostate?
Because you have urine and you've got another inch.
Okay.
If you have urine, you got another inch, you know you're in the bladder.
Okay.
Because the urinary outlet has a sphincter on it. Right? If you remember your anatomy. So that's how you know you're not going to balloon inside the urethra. Good question. Anybody got questions? Anybody else? Tara?
I reached my limit, didn't I?
Yeah, you did.
I'm just assuming that no matter what, bladder or urine will always come. Urine will always come out no matter like if they're dehydrated.
If
or
you're
anything.
in the urethra, on the female, you may not be in the urethra.
Oh.
Yeah. But, like,
Which, if you're not in the urethra because you're in the vaginal canal, leave it in place. It marks this is not the spot. On a female, it should go clitoral hood, clitoris, urinary meatus, vaginal opening. Aim higher than you want to aim. It is higher than you think. I promise you, it is higher than you think. Also, have them turn their head and cough. It will wink at you. I'm not kidding. It will wink at you because it's a sphincter. So it wink, right? It happens. And so if you can't find it, have them wink. And then also I told you about flashlight, another nurse holding anatomy, right? Ashley shared that her mother, who's a nurse, has the patient lay on their side and does it from behind on females. Great technique. Helps you visualize a little bit better. Okay, so it's going to be your preference. That's actually, she's like, is that okay? And I said, your mom's technique's actually in the book. So, alternative position for female catheterization. Other questions?
What position? Same position?
The alternative, it could be left or right lying. You're just side lying. It doesn't make a difference. Because it has nothing to do with the colon. Okay, see you guys tomorrow at 9.